Okay. So I think we're all set. Again, I'm Deanne Seekins. I'm the network director for VISN6, and I'm really pleased to be here today. What I want to do is just give you an overview of our network, and then I want to talk about some of the initiatives and some of the things I believe that we will partner together with the work group. So first, this is a map of our network, and we cover all of North Carolina and all of Virginia. And we have 7 medical centers and 35 other sites of care. So we have both states covered quite nicely. North Carolina is a very much a desired state for folks to come back and retire or to relocate. So we have been very fortunate after 5 years of just getting all the support we can possibly get behind us. We are going to be building a new clinic in the Raleigh area. So it'll be called a healthcare center. What the difference is with a healthcare center is it's kind of like a super outpatient clinic. It will house many services except for inpatient beds. So we'll do procedures there, we'll have specialty services, primary care, integrated mental health, and just a lot of things under one roof. It'll be almost 200,000 square feet, of usable space. So we're really excited. We're on the fast track, and we hope to begin construction next year. So I see thumbs up. We really appreciate all the support. I know that our congressmen, our senators, I saw a letter that was written. It was signed by all, just saying, please push this through and fund it. So truly appreciate that. I'll just lightly mention that we were also approved 2 other HCCs in our network, but those will both be in the state of Virginia. So I know that our colleagues here talked about the Secretary's priorities, but I just want to touch on those again. So greater choice for veterans is definitely one of the Secretary's top priorities, which when it's his priority, it also gets the energy and what we need behind it to support that. So we have made a lot of progress with care in the community, care coordination, and working with our veterans to ensure that they have greater choice. I see a lot of future initiatives that we're working on that are going to be even more beneficial to our veterans. Next is modernization of our systems, and I'll talk about that a little bit more in depth later in the presentation for our North Carolina markets. We have, as I said, a lot of veterans in this area, and it's just a pleasure to be able to serve them. Next, we have focus resources more efficiently. I see that really hand in hand with modernization. You know, when we talk about modernization, we also talk about having services for veterans available to them in their homes. And that's beyond the healthcare provider or the home-based primary care team actually going into their home. But it's talking about that they can have telehealth. We now have what's called VA Connect. So our providers have access from their iPhones to have iPhone connection with their patients in their homes. So we're really moving more towards that. We have done a great job with telehealth, where patients and veterans will come to the clinics and they may be able to see a specialist at Durham VA Medical Center and they're sitting in Salisbury or they're sitting at Morehead City. We really want to move that even closer to the veteran and see what can we do, how can we service that veteran at home. So we look forward to that initiative. Timeliness of services. I know that there's not a person in this room who hasn't heard the word access. If you haven't, we can talk afterwards, but it's definitely been a topic for many. Access at times is a challenge, and we have many veterans, as I said, moving to the area, coming to the medical center. In 2014, when the media kind of went crazy over, I always say I'm not going to mention that poor facility because it gets mentioned so many times, but it kind of took national life on. And do you know that our veterans, we went from, I can speak at the Durham VA, about 700 new patients a month to 1,000. So the veterans really spoke up to me and said, you know what, we want this service. And so we're coming forward, and that's continued. Our next priority is suicide prevention, and that was such a great presentation. Thank you. And again, I want to talk about that later, but I also want to talk about we all play a part in this. Absolutely every one of us. And when you look through our communities, we have done such a great job of ending chronic homelessness. And it's an everyday task we have to continue. So think about that with all that energy and all those efforts on suicide prevention. I know the VA data was up there, and it shows, how many veterans are committing suicide each and every day. 6 out of 20 are receiving VA care. So there's 14 out there that we have to be able to reach. And we want to make resources available to them. Sometimes it's the spouse who identifies the need. So I so look forward to our future partnerships and our endeavors so that we can work together. The next slide is our network budget. So we're a large organization, as you can see. We have about a $3.7 billion budget. And with that, we have research-supported dollars at about $26.2 million. Now, I want to go into a little bit more depth about research. That's definitely one of VA's, it's in our wheelhouse, it's one of our excellence, centers of excellence throughout the country. These are not the dollars that include grants, where our researchers actually go out and seek dollars. That's millions and millions more across our network. How many of you know that the nicotine patch came out of the Durham VA? All right. Shingles vaccine. Yeah, raising his hand over there. VA, across VA, we were the first to do cardiac surgery. We were the first to do MRIs. So people don't realize that with VA research, it helps all. And so a lot of work goes into that. Education and training. I know you've heard this figure. We train about 75% of the residents. So 75% of the doctors do some type of rotation through the VA. It's a training ground beyond belief. Our veterans have unique conditions. They have unique complications, comorbidities, and so it's a really, really great training ground. Also, another thing with veterans, which I know there's a whole lot of you out here, you don't always come to the doctor until you really, really need to. So we really want to change that and get you there ahead of time before you need us, and so that we can keep you healthy. We also have, our community care centers. We have choice. We spend about $145 million a year on choice, and that's care in the community. So that's a lot of coordination, and I see that we are continuing to get better and better at this. I wanted to let you know how many employees we have within our network. We have about 18,500. That's gone up about 3% since fiscal year 16. We have enrolled in healthcare, but not receiving total healthcare, but enrolled about almost 515,000 patients. We have almost 400,000 who actually receive care from us. And our visits are over 4 million. You can see we're approaching 5 million. So if you've been to one of the facilities lately, you probably believe these figures. Very, very busy. But that's fun. I like it. I'm glad. Okay, so this shows you our patient growth. So if you look at the first column is VISN6, the second column is national. So for 1 year growth, we're about 3.58%. And you remember the number I gave you back. It was about 400,000 patients, so almost 4% of that annually. The national average is 1.9. If you look at growth over the last 5 years, we've grown 21.4%. Nationally, it's about 10.44. So we're double that. And so when you see patients or veterans are moving here and that we're busy, we are. And the 10-year growth, we've grown about 42%. Now, I know there are many healthcare centers and private sector that would love to see those numbers. So we're also partnering with many. See, I have to do two things, talk and hit the slides. And so let's talk a little bit about modernization. So modernization, what we at the VA have done is really identify what are our core services. What can we do world class? What can we do better than none? And we really have identified primary care, mental health care, prosthetics, care coordination, and I'm losing the last, geriatrics. How could I forget geriatrics? So geriatrics is one of the areas that is, I'm sure this is not a surprise to you, but should in the next 5 years, we will get about 45% patients who will enter that category. So we definitely have to have that as one of our core services. We have been working very closely across North Carolina to look at our markets. You know, and our markets mean where do our veterans need their services? Where should we be? Where should we be partnering? So our first market analysis was conducted with the Durham-Fayetteville market area. And what we identified is that not only do we share many of the same patients because they're two very different healthcare systems, but services are not always convenient and readily available to these veterans. Also, we have recruitment issues in the Fayetteville area. It's difficult to draw those specialists. So we are partnering with WOMAC. For those of you that are familiar with WOMAC, we're expanding partnerships with our affiliates, and we have a whole marketing plan, which I think there's a slide in here that I'll show you in a few minutes. I want to make sure it's in here. Yes, it is. So I will share that with you in a few moments. We have a work group where we're working with Fort Bragg. We are getting ready to partner with UNC at the Fayetteville Medical Center. That's huge. We're drawing people to work with us because they see also that coming into our system, working with us, makes it a smoother transition for our veterans. This is a listing of some of the clinics that are either getting ready to open or have opened. I talked about the Raleigh Healthcare Center. We also have a replacement clinic in Rutherford. Anybody from that area? No, okay. Morehead City down on the beach. We're out for solicitation for a new clinic there. Jacksonville has exploded, and so we are looking at new clinics and possibly at HCC in that area as well, and then Brunswick. So as you can see, we're not sitting back on our laurels. We're saying, where are our veterans? What do they need? And let's go out there and let's get that. So this is the Southeast Market Plan that I mentioned. And so you can see what it covers. It's also a listing of what we plan and what our current system is showing we need. So by partnering with WOMAC, we're looking at moving our surgical services to WOMAC. We're looking at moving our inpatient services, but it's not, what we want to do is we want to actually create a hospital within a hospital. And what a better place. You've got a federal hospital, WOMAC. You have a federal hospital, Fayetteville, to have both of them under one roof and have both the military and the VA serving our veterans. So a lot more to come on that, but we're moving along, and it's so nice to have WOMAC at the table with us. This really talks about our goals, and I mentioned our foundational services. Urgent care is not a foundational service, but we do understand and have identified the need for that. So what we are looking at is do we partner with the minute clinics, as they're so called, and so that our patients can have maybe 2 visits a year at the minute clinics. So we're looking at how can we incorporate that, how can we coordinate that, and put those services, because I know if I have the flu, I don't want to drive 2 hours to get swabbed and to get the Tamiflu. I want to drive to my closest minute clinic and be able to get those services. So just to let you know, we're on top of it. So I came into the network in July, which created a vacancy at the Durham VA. Well, also one of my peers, Cindy Brayfogle, was the director at Asheville. On the exact same day, she became the network director in Tennessee. So it created 2 vacancies. And then those of you who knew Kay Green from Salisbury, she moved to New Mexico and became a CEO in private sector. And Miss Betty Goolsby decided she was going to retire, and she's joining the Peace Corps. So I felt a little lonely, but we have been actively recruiting. I can tell you for Asheville, I have a new director who starts there on the 20th of February. Her name is Steph Young. She's a current medical center director in Danville, and very excited to get her on board. I think she's going to be a great asset. And then I have for Salisbury and Durham, 2 that are in the pipeline right now being vetted, who currently work for the VA. And then I have a fantastic person from DOD who's being vetted for Fayetteville. So that's in the works. I am not going to be lonely by spring. These are definitely areas that we are focusing on. Leadership culture. And when we talk about that, it ties right in with engagement. Our employees are working hard. But what we need to do is we need to make sure that they have the support that they need so that every day when they hit those front lines, they can greet our veterans, greet you with a smile and meet your needs. So we recognize that, and we're developing an entire culture around servant leadership, because that's very important. It's your first impression. And if that first impression is bad, then most likely that entire visit has gone badly for you. So training, we're also doing identification of risk. So if we do say, okay, we're not going to do standard eye exams at the medical centers, that we're going to have your eye exams in the community, is there a risk? So we'll weigh the risk before we make those decisions. But I ask that you all think about that. How many of you that are not veterans drive to a hospital to have your eye exam? Probably not very many. Not many of you probably go to a hospital to have your teeth cleaned. So we're really trying to think forward and make sure that we can make it convenient and actually make sense. Transitions, I've talked a lot about that. Effective treatment. VA's quality is second to none. I will tell you, if you go on the sites and you benchmark VA quality, both outpatient and inpatient, our quality indicators are through the roof. Where we struggle is doing it with a smile all the time. And that's where we have to get, that your quality matches our attitude. And so that's a goal that I have as the network director. And research and science, again, that is such an important part of our mission. We have great researchers, and when they come up with a cure or something with TBI or any PTSD, it doesn't affect just veterans, it's for everyone. And so we have such strong affiliations and partnerships that I see the VA as a big, bright future. So thank you.